Get started. My name is Suki Steckel. Welcome to You're Getting Warmer, how using a system of care self-assessment can improve mental health outcomes for your state or community. And at INTAC, we wanted to let you know that we are the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. I am the System of Care Sustainability, Evaluation, and Implementation Team Lead for the center. I'm very pleased to be with you today. If you could move on to the next slide. Just a quick disclaimer to let you know this presentation was prepared for INTAC under a cooperative agreement with SAMHSA, who many of you all may be familiar with, and all material in this presentation is the opinion essentially of the presenters and not by SAMHSA specifically. Next slide. We do not anticipate any session security issues, but should some occur, please know that we will send you all an email and let you know what the new link is and how to hop back on there. Next slide. And just a little bit about our multidisciplinary team. We are, next slide in. We are a collaborative center, and you can see all of our partners here: Georgetown, CARS, Change Matrix, American Academy of Pediatrics, FREDLA, Youth Move National, MedStar, and the Texas Institute for Excellence in Mental Health. And our goal at INTAC is to, if you can, next slide. We are here to support all children, youth, young adults, and families with emotional or behavioral health needs. And we are especially interested in supporting the workforce and how to develop a well-coordinated system of care. Next slide is, these are just a couple of examples of who our cross-sector audiences are. Many of you all represent, I can see from the chat, represent a number of these different groups like school workforce, peer supervisors, the mental health workforce, state and local agency leaders, and we're happy that you all are here today. And one last note about our services is we provide individual consultation and training, peer learning exchanges, communities of practice, podcasts, practical tools, and webinars such as this one. So we hope that you all will continue to join INTAC on improving the children's mental health workforce as we move forward in 2023. And our team today is myself, and I'll pass it to another team member, Karina Joyner, to introduce herself.
Hi, everyone. My name is Karina Joyner, and I am part of the INTAC TA Center, and I will be moderating the chat, so feel free to drop any questions you have throughout the session. Thanks for being here. Jason?
Good morning, Systems of Care colleagues. I'm Jason Cram. I'm the Children, Youth, and Family Manager within the State of Wisconsin Department of Health Services, and I'll be presenting with my colleague, Ann Kelly-Key-Michael. Ann.
Hi, Ann Kelly-Key-Michael, System of Care Coordinator. I work with Jason in the Children, Youth, and Family section.
Well, I'll turn it over to you two to walk us through today's session.
All right, so some time ago, and we have a pretty short clock today on some of these slides, so I'm going to cruise through some of these, but some time ago, probably about 6 years ago or so, we conceptualized this idea that we needed to do a better job of working with our counties and tribes to help them evolve their children's systems of care. So we started developing a systems of care self-assessment tool. And ultimately, the purpose of that assessment is to engage, equip, and empower counties and tribes in the evolution of their children's systems of care. I think it's important to note in Wisconsin, we are a county and tribal operated and state supervised system. So counties and tribal nations have a lot of latitude in how they administer their behavioral health services in their respective areas. And so when we provide that technical assistance and oversight and collaboration with them, it really is this effort to help them evolve their system of care within their own kind of jurisdiction. And yeah, let's move on, Ann.
Yeah, I think it's also important to know that this tool was not developed by one specific individual, and that in Wisconsin, we have a Children Come First Advisory Committee, which helps direct the system of care in Wisconsin. And that group met with a smaller group of that committee, and they really, like Jason suggested, 6 years ago, they talked about we need to develop an assessment tools that can help counties and tribes really move their system of care forward. And so that group, composed of people with lived experience, counties and tribes, different systems, the Department of Children and Families, Youth Justice, they all got together to develop this tool together. So not one individual, again, and it really is about celebrating the uniqueness of each community, because every community is different and has different strengths. And so we wanted to really develop a tool that would help assess their strengths and identify those needs of those individual counties and tribes. What's also really wonderful about this tool is it does create this individualized kind of planning process and an action plan that people can walk away with to help bolster their system. I talked a little bit about the benefits, and so this is really, really important because the assessment doesn't just benefit counties and tribes itself, but having families involved in the process really gives them a voice and helps them grow and gives them strength within that system of care. The self-assessment can really identify and promote targeted efforts. So by helping identify the strengths and what we don't call weaknesses, but needs, they can identify and prioritize where they want to specifically work as a county or tribe. It also really does create that.
I don't got time for you right now.
I'm sorry. Oh, it creates that targeted, like that cross-system agency collaboration. So multiple agencies are working together, and that's the whole point, is making sure that that communication is happening cross-agency and through the communication within the cross agencies. It can help identify that implementation strategy, again, celebrating the uniqueness of each county and tribe. Each county and tribe can have their own specific implementation strategy or that action plan that they're walking away with. At the state level, it definitely identifies gaps in the training and technical assistance that we provide. And at the system level, it can provide those patterns and those trends that are identified. And so at the state level, we can work at the Children Come First Advisory Committee level. They can sometimes put forth some policy changes that need to happen or anything else that would support the system of care. So at each level within the system, at county level, at the family, the child and family and team level, at the state agency level, and at the ultimately the policy and those who influence policy and change level, this tool can help. Joanne, I think we're going to take a Zoom poll here of gathering the demographics of who is here. So maybe we could launch that poll. It's always interesting to see who is participating and who is learning about the tool, because regardless of what your role is, you can benefit from this tool. It's nice to see that there's tribes represented here today.
While we get the answers, I just want to point out a couple things. When we view systems of care in Wisconsin, we view it as we have a vision, which is children and families are valued, understood, and supported in their communities. And when we work with counties and tribes at the local level, we tell them that the whole design is that children get the right services in the right amount at the right time to meet their individual needs. And that's how we kind of approach every single situation where we're providing technical assistance to those counties and tribes. All right, we're at about almost 100%, 70 some percent of responses. I think we're good.
Yeah. Want to share those results?
Yep.
Wonderful.
So a lot of statewide folks, yeah. County, provider, tribal, national level. Very good. This gives us a great idea of where we're going to go from here.
Yeah, thank you. Right.
All right, let's go on. And next slide. All right. Some of you may be familiar with the concept of, I'm sure you're all familiar with the PDSA cycle, or Plan, Do, Study, Act. And we're going to actually come back to this a little bit later, because we use this throughout all of our, throughout a lot of our systems. And when we're at the end of the presentation, we're going to talk about how we use this data to make data-informed decisions. But we also use the PDSA cycle, which in Wisconsin, we refer to it as, and it's not just Wisconsin, it's called NIATEX, and we'll share that link in the chat at some point. But NIATEX is really a process improvement model that we use And we teach that to a lot of our, we teach that to the local systems of care as well. And we use that model too for the development of the tool itself. So we started developing this tool probably around 2016 or so, 2017. We went through a lot of iterations and a lot of testing of that tool, and we used that PDSA cycle to get us to where we are today. I think it's important to note, though, that we're not done. Even though we have a published tool, which we're very willing to share with you, we'll even put that link in the chat as well. And I'll just say this in case I forget later on. What we share, the link that we share with you is a published tool, but if you want to use it, there's no copyright to any of this. You're more than welcome to use it. You're more than welcome to modify it to meet your individual needs and just use our tool as a template. And ourselves too, we look at this as an ongoing process improvement. So we probably will make adjustments and edits to that tool in the next couple of years after we continually apply it throughout Wisconsin. Okay, the tool itself, we want to be clear, and we're very clear about this when we work with tribes and counties. It is not an audit. Although we are county operated, state supervised, we want to be very clear. This is not an audit in any way, shape, or form. This is a tool that, well, let me just get to what it's not, and I'll get to what it is. It's also not a fidelity measure, although there are fidelity components, especially with wraparound. If you've used wraparound fidelity measurement tools, there's a lot of similarities, but it's not really intended to be a fidelity tool in and of itself. It's definitely not an intentional attempt to find weaknesses within a system. And that's also very clear. If we did have that, if it was considered to be an audit, and we also had that intentional attempt to find weaknesses, we would not have that cooperative relationship that we do with the people with the tribes and counties who complete the tool. Also, it's not been normed, validated, or standardized. So, like, what is this tool then? Let's get to the next slide. What is it all about then? Go ahead, Ann.
Hi, Jason. I think it's also important we'll never require the tool. It's never going to be something that we require counties and tribes to complete.
Thank you. Right on, right on. So what is the tool? If you're familiar with the CANs, the Child and Adolescent Needs and Strengths, John Lyons used a word called, it's a communimetric tool. And we also kind of tongue-in-cheek use that word because we just love that word, but it's a communimetrics tool, and it's designed to really start a conversation. And you're all going to have an opportunity to experiment with just two little sections, two little indicators of that tool itself in a few minutes. But it really is designed to start a conversation. And it's really designed to break down a complex system into its elemental indicator form, indicator levels, so that you can identify what your strengths are and then what your needs are too. So what we attempt to do is we attempt to model the approach that we promote similar to wraparound itself. It is an assessment of collective understanding. And so by that, we mean it's not just one person's view of their local system of care. It should be, and Ann will get into the people who can participate in the completion of it. It really is an assessment of the collective understanding of all the participants of a children's systems of care. It's a way to open dialogue. And like I said before, it's an ever evolving tool. Okay.
So let's do a little bit of a quiz. This would be a good opportunity.
Yeah,
Is Joanne sharing the quiz?
Yeah, sorry about that.
No, that's okay. That's okay. This is just one question that we all want you to answer. I'm not seeing it.
It is not allowing me to pull it up.
Oh, no.
Well,
we can.
how about this, Ann? I'll just put the options in the chat and you can describe the quiz itself. How does that sound?
Absolutely. So Jason's going to put a list of individuals, and I want you to take a look at that list and identify who you feel would be critical to be at the table to help fill out the self-assessment. So you can choose more than one, but who do you guys think out of the selection? So like a local ice cream stand owner, child welfare, youth justice worker, school janitor, principal, judge, chief of police, family physician, parent, young adult, local fishing captain, one of my favorites, care coordinator, outpatient therapist. Who do you feel like would be the most important? Oh, I see an all. Parent, young adult, absolutely. Everyone. Care coordinator, all.
Oh, there's one there that says from Kim, depending upon the preference of the youth and family.
Oh,
Very good.
judge. Yeah, all, everyone. Well, to be honest, we developed this quiz, and depending on your county, your community, every one of these individuals may or may not take part in your system of care. So all of them. And again, it's unique to your specific community, county, and who's important in that community. We have, and these are some live examples. We have participated in system of care self-assessments where principals have been a part of it, and a school janitor has been a part of it. Child welfare workers, and we have a custard. We've always joked about getting, in Wisconsin, we have Culver's, which is now national, but Culver's was born and raised here in Wisconsin, and the gentleman that owns Culver's is here. And so we always joke about, you know what, he's probably pretty important in his community where he lives, and he would be a great person to get to the table to help with the assessment. Jason, can you think of any others? Oh, we've had tribes invite Public Works, the Department of Public Works, participate in their self-assessment. Can you think of any others that have been unique?
Well, how about we go to the next slide though, because that kind of outlines some of the more prominent participants.
Yeah, so we know that parents, youth, and young adults, people with lived experience, are critical to participating in the self-assessment tool. And there are, when we complete them in Wisconsin, there aren't any that are completed where families aren't in part of the tool. We've had young adults participate in the tool. Their voice, it's really essential that their voice is at the table as part of their system, part of their community, part of their county. People committed to the vision of the children's system of care. So when you see things like the fishing boat captain, you know, it's not a stretch to think that he could be a part or play a part in the lives of children and families in the community. And so having that individual as a part of the self-assessment is critical. Coordinating committees in Wisconsin, we have local coordinating committees that help direct the system of care. And so having them participate in the tool is essential to making sure that we get it right and that they have their perspectives in and a part of the tool and their thoughts are there. And community partners, like I said, with Culver's, you know, you think of Wisconsin, I'm just laying out Wisconsin, but Harley Davidson, we have Johnsonville Brats. I mean, there are community partners, YMCAs, some of the Boys and Girls Clubs, those community partners are so important. They play a part of the lives of children and families. They touch the lives of children and families. And so having their voice at the table is also instrumental. And it takes a little bit of work because you do have to kind of, with community partners in particular, you have to, you know, they have to have buy-in. Why is it they're going to be spending the time at the table? What is in it for them? And you have to have that speech or that conversation with them ahead of time so that they value coming to the table and they see the importance of them coming to the table. We talk about the wraparound process, and Jason talked about the teaming process. And so there is a big difference. We've learned that system of care and wraparound are very separate. Wraparound is a tool that is used, and it's critical. It's a critical piece of the system of care. We in Wisconsin, we use it to help facilitate the system of care self-assessment. So those of you who are familiar with the wraparound process, that is the teaming process at the child and family team practice level. And we can use it here, and we do use it here at the system of care self-assessment level. So it's identifying that vision. Where does that county or that community want to go? What are the hopes and dreams of that county and community in their system of care? identify strengths first and foremost. What are the strengths of that community and how can they be used? Those are stepping stones. So when Jason gets into the action planning, those are the tools those are the stepping stones that we can use in developing strategies to help bolster the system of care. We always start with strength. Underlying needs are those barriers to meeting the vision. So what are the needs of each community? We don't call them necessarily weaknesses, but the needs, the areas of needs. And so within the system of care self-assessment, you'll get to participate, but there's the rating scale. And so oftentimes counties and tribes will prioritize based on where they feel like they're struggling the most, or they have the lower number. And so they'll make a list of priorities and they'll decide. And so those are really those underlying needs. Those are getting in the way of them reaching their vision. And then strategies are those tools or those steps in completing those needs. So each of those prioritized areas should have very specific strategies to help them address those needs. And so again, this is the wraparound process in a whole. You're essentially creating a plan of care for your county or community, which is wonderful. You're walking away with an action plan. Steps for preparing to facilitate the tool. This is really critical because you can't just jump into facilitating the tool. So it's really important that you have like an internal meeting when you decide that the system of care self-assessment is something you want to try. You want to do it within your community or your county or your state. You want to have an internal meeting that kind of talks about how are we going to facilitate the tool? What's it going to look like? And as far as time frame, like, are we going to do this in one meeting? Are we going to do this and break it up? So how are you going to facilitate the tool? You want to make sure you take into consideration that action planning. People walk away with responsibility. People walk away with there's an action plan that's created and people can come back to. If you're just doing the self-assessment without creating that action plan, when you come back to revisit your tool and your growth, it's going to be pretty hard if you don't have that action plan. So that's a really pretty critical piece of the self-assessment. And again, you want to make sure that you're implementing and you're monitoring as needed. So there is no set time frame. Counties and tribes have monitored it on a 6-month basis, but you want to really have someone that's going to take the lead in making sure that those responsible for those tasks and that action plan are stepping up and they're doing them and that you're monitoring it. And just like within the wraparound process, if our strategies aren't working, if we're not meeting the needs, if we feel like we're kind of stunted, then you come back to the table. You don't have to wait. You call a meeting and get everybody back to the table and say, we're not moving at the speed that we thought we were going to move. Some of these strategies are not working. Let's change them. Let's evaluate. Let's figure it out. And so that's that follow-up and that ongoing evaluation.
Anne, would you like to say anything about the evolutions document? I put a link to that in the chat.
Oh, the evolutions document. This has been a key part of our system of care development and when the self-assessment development. So we were really, really close to publishing the tool. And 2 days, I want to say it was 2 days before the publish of the tool, we actually met with an author of the article, Gary Blau, and he shared this evolutions document with us. And Jason quickly set up a meeting with me and said, you know what, we've got some revisions to do. And so we didn't go forward with publishing the tool. And we actually we continued with incorporating many of the key components of the evolution document. It has been a framework that we go to and we look to as far as evolving the self-assessment. And Jason alluded to it earlier. This self-assessment isn't done. It's not one and done. It is ever evolving. It will continue to evolve just like systems of care should. So this tool, we anticipate that there's going to be some upcoming revisions, and I'm looking forward to hearing from you guys and what you think we should incorporate or where we may have some misses too. So that evolutions document, it's in the link of the chat. It again is kind of our framework. We've been using it quite a bit.
Maybe I'm getting ahead of ourselves, but I'll say that we were probably 90% there, but then there was a few key elements in the evolutions document that I think we were missing in terms of, and we knew they existed, and a lot of you are probably going to be like, yeah, of course, but we were missing that crisis component. We were missing that primary care component, which I see our colleague Kia, by the way, Anne is on the call. I see Kia's on, and she works with the primary care physicians in Wisconsin. And we were also missing a lot of the peer support and peer specialist component, which is also very much part of our system in Wisconsin, but we didn't really think about how to integrate them into the assessment. So those are the kind of the three big pieces that we were missing, that we thought we needed to stop, take a break, regroup, and then look at how we needed to revise our assessment. So I just wanted to add that.
Yeah, no. The components of any system of care, the article really talks about the principles and philosophy, the infrastructure, and the services and supports are the three key components to supporting a system of care in its evolution. I want to go into consensus building. Before we get into our activity, I think it's really important that there's so many things that you need to consider when you're building consensus. And so, am I on the right slide here?
Yeah, you are. You're good.
Good. So we want to make sure that, I am off my notes here. It's inclusive. And so you want to make sure that when you're building consensus, it's inclusive of everybody that participates in the tool. And this really can lead to quality outcomes that empower the group to really feeling a part of moving forward and a good future together. So that's why consensus building is important. Why is it important to teams? Because it drives the feeling of inclusion. It engages everyone that's in the self-assessment. It equips communities with a plan to move forward, and it empowers the communities to better outcomes for children and families. So considerations when you're building consensus within the system of care is, do you have the right individuals at the table? You can have a lot of people at the table, but are they the right individuals? Do they believe in the children's system of care in your area? You want to make sure that you have the time and the patience for completing the tool in building that consensus. So you want to have a keeper of time. You want to make sure you always begin with strengths. I talked about that earlier. That really can set the foundation for the conversation by talking about strengths and not starting with barriers. Talking about strengths can really direct the conversation. Staying on track, again, is important when building consensus. You want to have a culture of equal participation. So you encourage all of those involved in the self-assessment to participate. Not one person is speaking. As choosing your facilitator, I see in counties and tribes that have completed them in Wisconsin, some of the best facilitators are those care coordinators or those service facilitators, because they're in tune with who is at the table. They're in tune with paying attention to who's participating. They're in tune with calling on individuals, to making sure that everybody's voices and their ideas are put forward. And you want to come up with an agreement that everyone can live with. It's not a one and done. It's an ability to really get everybody together to agree. This is the best part of sitting in some of the self-assessments, watching the teams come up with this scoring, which you guys will experience in a little bit. Watching people come up with the scoring is some of the best conversation, because some of the group will say 2, some of them will say 3. I've seen counties and tribes really come up with okay, we're at a 2.65. I mean, they really have, they're creative in how they build that consensus that everyone can live with, essentially. So how are we doing on time?
Right on time. We're good.
Perfect. So this is our small group activity.
Yeah. Next slide, please. Actually, next one after that. There we go. All right, we are going to break you out. I'm going to do a little bit of explanation, and then Karina is also going to do some further explanation about the actual Jamboard tool that we'll be using if you've never used that before, even if you have used it before. But we're going to do a little group activity. So the assessment itself, and I know we put a link to the assessment in the chat before, and Karina, if you could do that again, I'd appreciate it, just so everyone has it at their fingertips so they can kind of see. But you'll see that there are multiple elements. There are, I think, Anne, like almost 40 or so different, maybe not quite so many, 30 some different indicators that we are looking at assessing. And each of those indicators, I mean, if you can imagine, some of those indicators, like Anne was saying, can take hour, 2, 3, 4, 5 hours to just decide upon one. So in some instances, this is like a 6-month process for some tribes and counties. Other times they can do it in a couple of days, depending upon how detailed they want to get. So we want you to experience that. I like to think about that opportunity of experiencing the indicator almost as like a holding environment. And there's going to be distress in that holding environment. The key for the facilitator, though, is to regulate that distress and to come to a consensus and where everyone feels relatively comfortable with that rating. When we conceived of the tool, we wanted to be a forced choice. So we only had a numerical score of 1, 2, 3, and 4. And then the respondents got creative and started doing decimals, and we're fine with that. But really, we wanted there to be a forced choice. So there's this indicator of 1, 2, 3, and 4, which I'll get to in a second. So we're going to break you out into small groups, 7 or 8 people per group. Make sure you identify a spokesperson, because we will have a sharing time at about probably 10 to the top of the hour. I know you're across the country, so in about 18 minutes we'll have a sharing time. So make sure you identify a spokesperson. We probably won't get to every group for that sharing opportunity, but we want to hear from a lot of you. We also want you to come with your own hat, which is why we did that original poll to see where you came from. Some of you are parents, it sounds like. Some of you are people representing people with lived experience. Some of you are national representatives, county representatives, tribal representatives. And even within each of those areas, you probably have multiple hats, whether it be, I saw someone from probation and parole on. I know there are a number of people from youth justice and child welfare on. I see people from systems of care coordinators on. So you do already come into this situation with a lot of different roles and responsibilities. So we want you to wear your hat. In an actual functioning of this tool, you all would be from the same system of care if you actually completed it, but we realize that that's just not possible. The purpose of this exercise, though, is just to experience it. We know that you're not going to come to any major consensus because you're all representing systems of care from across the United States and our territories, but we just want you to experience what it's like to actually complete part of the tool at just one of those indicators. And again, you'll be using the Jamboard to help with that process. Next slide, please, Anne. When you complete the tool, please don't use decimals again. It just kind of, we don't need you to get that deep into the weeds. So if you rank yourself a number, is that right? I thought it was flipped like that. Anyway, we'll just use this. If you rank yourself a number 4, it means that your system requires significant attention. It means that, Anne was saying it's not a deficit area, it's an area of need. And so think about it like that this is an area that requires significant need in your system. A number 3 would require moderate need. A number 2 or a number 1 means you're probably on the right track. And in fact, the theme of our presentation today is you're getting warmer. And that's kind of how we approach this, where 1 is, you are right on track. You're doing phenomenally well in that particular indicator. And number 4 means that you really could use a lot of attention there.
Jason,
Again,
you were right.
Go ahead.
Right. It is flipped. 4 means that they
Doesn't matter. Doesn't matter.
Yeah.
Let's just go with what we got, though. 4 is
Okay.
significant attention. 1 is you are spot on, 100% great to go. Again, I want to remind you, make sure that you have a spokesperson. And then Karina is going to go over the Jamboard instructions. And also, we will make sure that you have at least 10 minutes for the breakout session, so that by the time Karina gets done talking, we'll give you at least 10 minutes, but we will then regroup at 10 minutes too for the sharing time. All right, you can stop sharing, I think. Anne, are we? Yep. Oh, no, I'm sorry. My bad. Sorry, Anne. If you could go back.
Yeah, it's okay. Y'all can stay on here because those slides are in the Jamboard.
Okay.
That's
Karina,
true.
could you go to the next Jamboard slide and I can show you there? One more. My bad. I apologize. There we go. So here's how we're going to do it. If you are you don't have to remember your team number. Just remember whether or not you are in an odd or even group number. So again, all you have to do is remember if you are an odd or even group number. If you are in an odd number, then you will be addressing the cultural and linguistic responsiveness indicator, which Karina is showing you here. If you are an even number group, then you'll be representing or you'll be responding to the health and mental health integration indicator, which you will see here too. That's all I had to add. Thank you, Karina.
Yeah, for sure. So yes, just what Jason said, when you get pulled into your breakout rooms in just a moment, you will use these arrows at the top of the page if you've never used Jamboard before to navigate between the slides. You've got your rating scales here, and then what each number is going to signify. And so if you remember whether you're an odd or even number, if you go over to the left-hand side and click the T for the text box, you can just make a little box and put your name in it. This is when you are put into your group. Go ahead and claim one of the Jamboards. So there's going to be 6 per whether you're cultural, linguistic responsiveness, or health, mental health integration. And Sugi has posted the Jamboard link, so I see that some of you guys are already joining. And are we good to go ahead? And Joanne puts you in your rooms?
Yes, everything's ready.
Yeah, why don't you stop share, Karina, and then that way folks can see the screen better. And feel free to, as you're getting in your rooms, if you have any questions about the Jamboard link or anything like that, please let us know. And you should have about 11 or 12 minutes in your discussion. And there is a little refresher on the scoring inside the Jamboard, so you don't have to worry about kind of linking back to the main room or slides or anything like that. And but you can always ask a host for questions if you have questions while you're in the breakout.
Suki, I see Kia asked a question, and again, the question she asked is point of clarification. Does for significant attention mean that there's already a lot of effort being put into that, or it means that, okay, for the purpose of this exercise, ultimately, you guys, it really doesn't matter, because we want you to experience the process, as long as you can agree to whatever the process is within your group. But as if you wanted, just to be clear though, when we explained it, significant attention means you guys need to put a significant attention into that, because there's not a lot going into it right now. And a 1 would indicate you're stellar, you're awesome, you're fantastic. You probably don't need to put a lot of attention into that if you were that system of care. So 4, you got to do some work. 1, probably not a whole lot of more work needs to be done, if that makes sense.
Yeah, so the higher the score, the more work you have to do. The lower the score, the less work you probably have to do, because you've probably already done a lot of work in making that progress.
Exactly.
So
I think we're ready.
Yeah, and really just encourage you all to just wear the hats that you wear every day and lean into the discussion and enjoy the ride. We don't expect perfection, just for you all to experience some of the tension that comes with trying to build consensus with a group. So I think Joanne's going to post the Zoom breakouts, and just remember if you're odd or even. And we'll see you back in about 10 minutes. All right, welcome back, everyone. Jason and Anna, take it away.
Thank you.
Well, welcome back.
Welcome.
So we're going to take the next 10 minutes, and I'll just try to call upon the breakout rooms here, and then if you could identify who your spokesperson was, and we'll hear from a handful of them. So again, the odd number breakout rooms were the cultural and linguistic responsiveness ones, and then the even breakout rooms were representing the health and mental health integration. So let's just start right with, let's hear from folks in breakout room number 1. We have looks like about 6 people in there, and that's the cultural and linguistic responsiveness. So who from that group would like to share? Again, not so much, although the rating is important, it was more the experience of completing the tool and that indicator of the tool, and any observations that you had, and if you want to share, we'd be more than happy to hear too what your score was, keeping in mind for everyone that score represents people from across the country. So breakout room number 1. Anybody like to share?
Beverly, I think that's us.
Yeah, I can read the names. That's right. We have Beverly B, Joanna J, Kia K, Kim S, Michelle C, and Penny Q.
Okay, I apologize because I was not aware that we were supposed to be assessing 12D. So we did not go there. We actually were addressing the very first one. That's where we started and what they were talking about. So I apologize. That's
No problems at all.
not where we were. All I can say is that for the state of Nevada regarding this, that's where I am from, and I'm part of our system of care grant unit. As far as like incorporating telehealth and integrating services by the primary health care and mental health providers, we are working toward that. We have a pediatric access grant also from HRSA, and we work closely together. I actually have overseen both of them, both that grant, and I'm providing support through the system of care grant as well. So we really are engaged in that telehealth. If you know anything about Nevada, it's 2 counties and then the rest of Nevada. So it's Washoe, where Reno is, and then Clark in Las Vegas. And everything else is rural. And it's definitely, you have to be creative and you have to really work together and collaborate using whatever systems you have. And so we're trying to really reach out to primary care physicians, helping them understand and have tools and so forth to be able to address the needs and then know where to refer if a child comes in and they have that need. I just wanted to put a bit in for the things that we did discuss in our group. We talked about family and youth involvement. And obviously, if you have any experience with systems of care or wraparound, you know that if the child is not involved and engaged and actively participating, then you really have nothing going for you. You have to have that family and youth involvement and collaboration. So I was asked to make sure I said that. So there you go.
Thank you so much, Beverly. Thank you very much. Moving on to, let's just pick group number 2. We're kind of going to go in order for the next probably 5 minutes or so. We have Bonnie T, Jen D, Carla G, Kristen J, Margaret V, and Valerie B. And you guys were assigned the health and mental health integration indicator. Who from your group would like to share?
I don't mind doing it. It took us a few minutes to figure out Jamboard. So you've got sticky notes on the slide because that's all I could figure out how to do at that point. We talked about how we're all at different places. One of us, there's no integration. Things are still completely siloed. Some of us have started those establishments. So we feel like we're in that like 2.5 to 3. And New Hampshire, who I can speak to because that's where I work. Our system of care is completely integrated because we have an RSA that helps co-facilitate the Department of Education, the Department of Health and Human Service. And so we work on the system of care together, and we have supported school liaisons through our community mental health centers in some of our school districts to integrate that community mental health, but make sure that it's still separate from an academic school environment. But it takes place within a school for those schools that are ready, willing, and able to participate in those activities. So we kind of felt like we were all over the place with that. So, but the average was about 3.
Yeah, thanks for that, Jen. One of the other projects that we have in Wisconsin is we completed we issued a statewide survey, and we had over 1,000 respondents, of which 500 actually fully completed the survey. And it was pretty interesting when you said we were all across the board, because even within a specific system, there were people who said, I had no idea that even existed, all the way to people saying, oh yeah, we use this all the time. And it was even within that same county or tribe that we saw that kind of disparity. And so it kind of lends to what you were saying, Jen, is that, you know, although this is kind of just a proxy for what it would be like to actually complete the survey or the self-assessment tool, it was really kind of eye-opening for us for us to understand that there's vastly different perceptions of what exists for a given service or support in that given community. Let's go on to group number 3. We have Alice A and Dan, Danielle P, Gail P, Hillary H, Jamie M, and Katie H. You guys should have completed the cultural and linguistic responsiveness. If not, that's fine. What did you guys come up with for a spokesperson, and what did you guys come up with for some observations?
I guess as the person who took the notes, I'll comment. So we came up with well, if you average what we were talking about, we really didn't get to an end conclusion. It's probably a 3. So we had 3 folks who were down in the 3-4 range, and someone who really thought it was 1-2. So we, when you split the difference, we didn't have time really to work through a consensus building. And we have to give a shout out to Katie, who is here on her first day of work. So thank you, Katie, for being here. And so yeah, that was our process. We really hadn't got far enough along in the conversation to resolve any consensus around the differences we saw.
So Hillary, how did your group then deal with that or address that? And I realize there was a time factor, a very major time crunch, but how did you did you address that distress or that consensus, that need for consensus versus the time versus not even able to come to one?
We ran out of time because the 1-2 came at the very end. So you cut us off halfway through the, yeah. So sorry, no, we didn't get any further than that.
No, and that's okay. That's all part of the process too. Yeah, time constraints can be a part. And when counties and tribes are doing this, there's indicators where they spend more time on it than other indicators. So that's going to happen. But it doesn't surprise me that you didn't necessarily come to a consensus in the time allotted. But what's really good to hear is that you were having the conversations were happening. You absolutely were discussing like who was on the upper end or who was on the lower end. And as those conversations continue, that's where the magic kind of happens, is that you get more and more aware of where people are at. And it becomes clearer to you where you're going to score and how you're going to score. So, and the point of scoring is not to go into solutions. This is really an opportunity to identify those underlying needs, because as if you were in the wraparound process, you don't want to start strategizing until you know what the needs are. And so this is the opportunity where you're identifying those areas of need. And later on in that action planning that Jason talked about with NIATEX, that planning development, that's where you come up with those strategies. And so all of this is about kind of pointing out those underlying need areas. And so we don't go into like the strategizing. I see Penny has her hand raised.
Yeah, that's a great concern for me because of the issue of, well, one, we have a lack of stakeholders in my county, and we're the most distressed county in our state, but also because we see our stakeholders being siloed and also not working with each other, and then the difference between what's going to be provided and what we as the families need. Yeah. So is that addressed as a problem in this section of time? Because as a consumer, if it's not addressed at this point, we're not getting, one, what we need, and two, what we deserve. So it's a great concern. I can give a really solid example. My child was always rated as a 1 for drug and alcohol risk. When we went through the wraparound services, they continued to do that no matter what I said. When the first cans was done, he signed away a paper. The only thing he said I couldn't know was his drug and alcohol testing. I tapped on the paper, pointed at the person doing the assessment, and I said, my child just told you he's using. At that time, he was using alcohol and smoking occasionally. When we exited the wraparound services, my child was crawling through his bedroom window, and I was taking him to rehab because he had prostituted himself out for opioids. He was rated the entire time as a 1 risk for drug and alcohol use. They never rated him higher, no matter what I said or what was available for him. This is a great concern as a parent. How do we address that?
I don't know, Jason, if you have thoughts. What I hear you speaking to, Penny, is at the child and family team level, it seems as if there's not a consensus about what the needs are for your son. And so if we're going through the tool, when we talked about making sure that the right individuals are at the table, I think that's where we start. So at the child and family team level, which is a huge part of the system of care in general, but at the wraparound child and family team level, making sure you have the right individuals at the table to make sure that you're addressing the right needs is going to be critical. And so the system of care assessment that has been created in Wisconsin doesn't necessarily address your concern, Penny, specifically, but it addresses the system as a whole, getting to how does the system help individuals like your child better. Does that make sense?
Oh, absolutely. I mean, and we're well past that. I am now working at a legislative level, helping to write bills, pass bills. I did not know at the time that a 13-year-old was in charge of their own mental health. We are well beyond that. We've done 2 years of inpatient. We're working hard. So we're far beyond that. I'm just saying, I'm forewarning anybody in this process, something at this level has to be in place for this kind of fall through the cracks, because this is where I saw the initial problems starting. And I don't want that for any other family. I would be pulling away and enjoying my 6 children and not taking on the weight of changing laws and making things better if it weren't for what I saw. And this is the start of where you see the cracks happening. So how do you address it at this level to stop the cracks from happening? I'm just telling you, this is your forewarning.
Yeah, so thank you for that, Penny. And when we first started launching this tool, and I'll be brief about this because we do have to move on, but when we first started launching this tool in its infancy stage, its pilot stage, probably 4 or 5 years ago, we didn't provide a lot of guidance to the tribes and counties on who should be at the table in terms of partners to complete the tool. And we quickly realized that was, a mistake on our part. And the first county that completed it really only did it in-house within the county behavioral health system. There may have been 4 people at the table, and they were all from the same system. We realized that's clearly a mistake. And again, we don't have the authority to tell people who has to be at the table. But in our initial consultation with tribes and counties, we tell them, this is the group of people that we recommend you have at the table, and put that earlier on, we were talking about the ice cream vendor. And in many instances, they could be part of that system of care. Now, obviously, that's more of a natural, non-traditional support, but nevertheless, they can be part of that system of care. And we really tried to work with a given champion in that tribe or county, who then we can consult with and say, you are going to be leading this process or facilitating this process, not necessarily leading it, but facilitating this process. And in order to make it real and accurate and a good representation of your system of care, you've got to have the right people at the table, bottom line. And then we go through a kind of a checklist with them to make sure that at the very least they have these folks invited, and they should then be going back to that group and saying, who else do we need here, so that we can accomplish, and we don't have people falling through the cracks in this higher level assessment. All right, Anne, should we move on? We're behind a little bit on time.
One thing, help them find their supports, and realize a lot of their supports run away when our children are in crisis.
Thank you, Penny. Thank you very much.
Thank you. Which speaks to that unconditional care that Jason so passionately is pushing. He's always at the top of our principles. Unconditional care is first and foremost. We can't just give up. Yeah.
All right.
Have time for one more group or more?
No, we're out of time. We've got to go to the next slide.
Oh, boo.
I know. Thank you, everyone, for completing it, though.
Yeah. Thank you.
Thanks.
So the indicators of the self-assessment. So the self-assessment is broken down into 4 different areas. And so can everybody see the screen? I'm sharing good?
Yes, we're good.
All right. So the 4 indicators are the guiding principles and philosophy, readiness, practice change, and human resources and funding. So when you're doing the tool, you'll see it broken down into those 4 different areas. The first focal area is the principles, and these may be familiar to you if you serve children and families through wraparound. These are the principles that guide the wraparound practice, and in Wisconsin, they are the adopted principles that guide the system of care. There are 4 that we really hone in on, which are the community-based, family voice and choice, cultural and linguistic responsiveness, and unconditional care, making sure that we don't give up on children. So we have been, over the last couple of years, really highlighting those 4 areas based on the evolutions document that Gary Blau and Justine and Beth Stroll all wrote when they talk about the principles. So, but all 10 of these, we feel like all 10 of these areas are very critical to the system of care in your state. So the first part of the tool you'll see is addressing or rating each of the principles. The second part of the tool is the readiness. So you'll see indicators broke down by youth serving systems collaboration. So you'll rate how your county, community, state is doing in that area, local leadership, their participation in the system of care evolution, internal partnerships. Just internally, the partnerships that are within the agencies, fiscal policies and sustainability. How are we supporting that sustainability of the systems? So continuing beyond that transfer. And then public health approach, you'll see is another section of the area 2. The third focus area is practice change. So single point of access, we talk about an assessment process where families don't have to tell their story to 8 different programs to determine whether or not they meet the criteria. So there's a single point of access, screening and assessment and intake. What does that look like? Family-driven, youth-guided, and strength-based treatment plans and services. Mental health integration. You guys just walked through that one. Education and skill building offered. Evidence-based practices and practices-based utilized. Trauma-informed systems. So not just trauma-informed services, but the system as a whole. Services meet the mental health and or substance needs. Care coordination and unified treatment plan in place. So one family, one plan. Again, some of these were included as a part of the evolution document that we talk about, and some of them were in the original. But all of them are critical to making sure that your system has the right services and supports in place to help families.
So Karina, could you put the link back to the actual tool back in the chat? Because I see people coming and going, and I want to make sure they have access to that.
Yeah.
We are flying through these focus areas pretty quickly. So there's 4 different focus areas, but I want you to take an opportunity to, Karina will put the link to the assessment in the chat. And if you scroll halfway down through that web page, you can then click on, I forgot what the actual says, but Systems of Care Self-Assessment PDF or something like that. Or no, it's actually an Excel document. My apologies. It's in Excel. And then you can see what we're talking about here when it comes to the actual self-assessment tool. And we, like Anne just went through the first 3 sections, which were the guiding principles, the readiness, practice change. And then the final section is the human resources and funding. And these are relatively arbitrary breakdowns, but it was just a way to conceptualize different areas that were important to a system of care. Again, I'll just review them. It's the guiding principles, which for us, it's the wraparound principles. It's the readiness of how ready that system is to move forward. The practice change, and then finally human resources and funding. So these are just the considerations. Is there funding available? If there's not immediate funding available, what other services or supports can be accessed for minimal funding, perhaps? Medicaid reimbursements are all part of this too. Coordinating committee, if you have a coordinating committee or that kind of structure, how important that is to driving that system forward. The team meeting facilitation, so I'm just kind of skipping around, but these are all important components. And if you take that tool and you want to adopt it, this is probably the area that, you could probably do some flexing in. Actually, all of those areas you can do some flexing in, but nevertheless, think about it. If you're going to adopt the tool and use it as is or edit it. And by the way, we wash the tool of anything specific to Wisconsin because we realize that it might have implications or applications outside of our state. But these are all components that are key to making sure that you eventually will have a successful system of care.
There's also a guideline included as a part of so when you click on the link, you can also see a guideline that was published. And so each of these sections is broken down pretty specifically. Some of the counties and tribes that complete the system of care self-assessment, they actually keep that right next to them so that they can reference it when they're completing the tool. Gives them a better idea of what they should be looking for in each of the sections, which we talked a lot about the evolutions to the tool, so I don't know necessarily if we need to focus on this, but and again, it was based on a lot of that evolutions document, and we anticipate that this tool will continue to evolve.
Before we go on to the next slide and wrap things up, or moving towards the wrap up, I do want to address Penny's question. If we just work with Medicaid recipients, no, absolutely not. We work with anybody who receives, any people who have private insurance or Medicaid or completely uninsured. There's no, in Wisconsin, in terms of how we apply our approach, it's to all individuals who need that service in Wisconsin. Now, when it comes to funding services, that's going to be dependent upon, of course, their Medicaid status or their insurance status too. All right, recent evolution. Oh, are we past that? Are we on state level funding? Okay.
Yeah, we are. We've talked a lot about the evolution of the tool related to the document.
So this is where, Karina, if you could put the link to the NIATEX into the chat, please, I'd appreciate it. So when we completed, so what we ended up with in Wisconsin is we've completed, I would say, let's see, and I think about a dozen or so tribes and counties have completed the tool to completion. Other folks, other entities are in some phase of completion. And in fact, we had one consortium of 9 counties in our very rural part of Wisconsin complete it too, which is pretty fascinating because they did it not only individually as 9 counties. So if you want to count that as a 9 counties, we are probably more closer to, I think 20 counties have completed it. They completed it as a consortium and they all individually, and they also completed it as a consortium too. And so they do a lot of crossover of services, which was pretty fascinating. And not only did they do it for the children's systems of care, they did it across the lifespan, which again, they did their own interpretation and the results were absolutely fascinating for us. But we now have this body of knowledge, of this body of information, this information that we are able to then look at Wisconsin almost as a system. Now we have 72 counties, 11 tribes, so 20 is certainly not anywhere near half, but we are starting to kind of develop this body of knowledge of what the state of Wisconsin looks like in terms of the needs and strengths of our entire system. And we've identified 3 needs areas, and those are natural supports, cultural and linguistic responsiveness, and data-informed decision-making. And we've identified these because if you take all of the scores that for the tribes and counties who've completed the assessment, which we also ask for and we get them, and put those into a spreadsheet and then average those out, these are the 3 areas that Wisconsin is identified as ranking pretty significantly low in, or maybe I should say it as, these are our strongest needs areas. These are not our strength areas. And so in response to that, this then activates us at the state level, because again, we're county operated, state supervised, and we view ourselves primarily or largely in the role of advocating for not only enforcing minimum standards, but advocating for best practice. And that's how we really have developed this strong relationship with NTech, in fact. So for the natural supports, for all of these, we then provide technical assistance at a statewide level. So I'll just be very brief. The natural supports, we have been providing training at statewide conferences and seminars on how to develop natural supports at the local level. We bring in experts to talk about those. We do these via webinar. We have a training partner that we work with, a technical assistance partner that we often work with, and they help us host and put together these trainings and TA opportunities. For the cultural and linguistic responsiveness, our state has invested on multiple occasions now, in 3 different occasions, in what we call mental health. Let me think of the actual title. It's to provide a technical assistance forum to diverse population needs. And so what that equates to is we provide grants at the state level to counties, tribes, and nonprofits who have identified the mental health needs of diverse populations, and they then in turn host and put on trainings specific to the mental health needs of those diverse populations. So for example, we provided grants to an organization that supports and provides training on the mental health needs of Muslim women or Muslim individuals across Wisconsin. Hmong population too, we have a number of people who are grant recipients or entities who are grant recipients for the mental health needs of the Hmong population, rural folks, the Rohingya community, farmers in Wisconsin, let me think, Hispanic and Latinx and Latino and Latina populations, African American populations. So these are all people who have received grants who then in turn have provided some kind of forum, whether that be webinar or training on the diverse needs. And then finally, data-informed decision-making, and that's what we put the NIATEX link in there. We also work with tribes and counties across Wisconsin to help them gather data. In fact, we provide them some of that data using a variety of data sources, doesn't matter what they are. And then how to use that data to make informed decisions, and then using the NIATEX process to help move their system forward on an incremental and measurable level. And that's been very valuable. And the tribes and counties have been pretty excited about that because they're able to kind of zero in on a particular area and then do a rapid cycle quality improvement project, get some more data, see where they stand, and continually work towards that indicator until maybe they move the needle from a low score to a higher score. And next slide. Let's see. Go ahead, Anne. Oh, this is my slide. Implementations considered in lessons learned. Like I said before, one of the things that we quickly learned was we need to do a better job of providing some TA to the people who complete it to make sure that they're involving all the right partners at the table, including people with lived experience. We need to make sure we also learn quickly that it can't just be one individual system in that county or tribe who completes the tool. It has to be multiple system perspectives. We've learned quickly, this was the exciting part, that there's hidden strengths that have been identified, and not just within individual tribes and counties, but also at the statewide level, where we're like, wow, we didn't really realize that collectively people thought that this is a strength in that particular area or across the state. And then also the time frame considerations. Technically, you could complete the tool in one sitting, but my gosh, it really should be a multi-month process in order to really get down to the level that you need to for a good, solid assessment. All right, Anne.
And then Jason talked a lot about this too, the considerations for adapting the tool because it's not copyrighted. I mean, the 9-county consortium, they adjusted the tool to fit across a lifespan. And then there's another county that wanted to start just basically with the principles. And so they just did the 10 principles to start them off. And they thought, because, we really can't go into practice, we can't go into services until we have a consensus on how we're going to deliver the support. And we need to be all on the same page related to the philosophy that we abide by. So they started there and they worked their way through the tool, but started with the 10. You can do this statewide versus individual counties and tribal nations. Jason talked about that. At the statewide level, we're using a lot of this information. I can't tell you a meeting where we don't pull up the information and say, okay, where do we need to focus? And then, is there a clear plan for everyone to follow? So I talked about it earlier. We could go through the assessment, you could rate yourselves, but if you're not prioritizing and developing that action plan, it's kind of for naught. So you really have to kind of walk away with a very concrete action plan. And counties and tribes have really determined that 1 or 2 areas are all that they really can focus on, and that they kind of parking lot some of those other areas that are prioritized. But this is another opportunity for the group to gain consensus on areas that they need to work on, because they together choose which areas. So which are the 2 or 3 areas, 1 or 2 areas that they're going to focus on together to move their system forward. Once those things are met, then they pull from the parking lot and work. We wanted to also use this opportunity. I know we don't have much time, but we wanted to use this opportunity to learn from you guys. I mean, we are not the system of care experts. We don't claim to be. We put together the self-assessment as a way of us learning from counties and tribes. And I can't tell you how much we at the statewide level are learning so much from the counties and tribes related to what we can do differently and what we need to enhance and what we need to consider. But are there areas, and if you want to drop them in the chat, are there areas that you feel might be missing in your quick review of the tool? It's been shared a couple of different times during the session. In your quick review of the tool, do you see any areas that we're missing? Do you see any key indicators that are missing from the tool? Because this will be forever evolving. And so I anticipate that within the next year, we're going to be opening it up the document and making some necessary adjustments and additions to it as we've been keeping kind of notes of areas that we may need to create more focus on. But if you, yes, please drop them in the chat. This is our opportunity to learn from you guys and take into consideration in your specific systems of care within your state, within your counties, within your tribes. Are there indicators that we're missing? Things that we should consider as we further develop our tool? And I think that's our last slide.
Yeah, as you all are dropping those in the chat, I would be very interested to see that as well. Do you want to share the resource page, or were those the links to the assessment, Jason?
Everyone's going to get a copy of the slides, I'm assuming, because they registered. So
Yes.
It's simply just a link that Karina has been putting in the chat all along to the assessment itself, and which is the launching page being our Wisconsin Children's Systems of Care. And I think there's also contact information for us in either in the slide deck, or we can make it available. But if anybody has questions for us, we'd be happy to respond, at a later time too.
That's great, Jason. I have learned so much today, and I really appreciate both of you sharing Wisconsin's journey in developing the self-assessment. And just to wrap up today, there's a couple of important announcements I want to make. And also, I'm not sure that this was made clear at the very beginning, so I wanted to kind of call you and your team out in Wisconsin a little bit. I know many of the folks who are online right now are either have received or are in the process of implementing a CMHI grant or a system of care grant from SAMHSA. And you all in Wisconsin have completed all of this work and are actively engaged in supporting local and regional implementation. And you do not currently have an SOC grant, correct?
That is correct. That is correct.
You have not, and I know this took about 5 years to develop this assessment, and you did not have a grant during that time, right?
That's correct. It's really, and it was through the visionary leadership of DHS that we got to this point. And could you go to the next slide too, please? So.
And so I just wanted to point out, we don't unfortunately have time for too many questions, but there's a couple of things I want to answer. And please do, if you have a question, go ahead and put it in the chat. I'm just going to make some announcements, and then we'll hop back and answer your question either via the chat or we'll respond to you afterwards. So one thing that we did when we were thinking about how important self-assessment is, either at the state or local level, and thinking about your journey in Wisconsin and what you've been able to do without SAMHSA funding, or specifically the grant funding for this, As someone who has implemented many SOC grants, it's very inspirational when I see this level of energy and commitment to system of care implementation without the grant funding. And so I hope it's inspirational to others. And so when we were thinking about how to share this, it really is overwhelming when you get into the level of detail that we have. And so we decided to do a 3-part series. And so when you all registered for this session, I believe you had the opportunity to register for all 3, but you can still, if you didn't do that, you still have time to register for sessions 2 and 3. At the next session, and Christy, this speaks to your question in the chat a little bit, Anne and Jason will be hosting members of their local community, both I think the regional coalition and the one of the local groups who completed the assessment, to talk through their process and outcomes that they saw as a result of that assessment. And then our 3rd session, we're going to focus on tribal communities. And so I'm very excited about that. I know there's some members from tribes here on online today. So please do welcome, and we can always learn from this. So even if you're not a member of a tribal community, really encourage you to attend session 3 as well. And very excited about this. So we'll repost the registration link. Joanne has also posted the evaluation link for today. So we really appreciate you taking the time to fill that out. INTAC is also very interested in data-driven decision-making. So we are always looking at our data and how to improve these sessions. And so really hope that at the end of all 3 sessions that you all will have a really good understanding of some of the implementation considerations and outcomes that are possible when you take the time to assess where you are. And we know that when one of the main aspects of implementation for SOC is really, translating those values to verbs. How are you taking this kind of lofty goal, this big system of care framework, and really putting that work into action. And so one of my favorite phrases is better process, better product. And I think that this self-assessment process that you all do, and really stressing the wide variety of folks that you need to have at the table in order to get a better product, and taking the time. I think if you missed this comment that Jason had, it can take months to complete the assessment in a meaningful, intentional way. And then you have copious amounts of data that you can use to inform your strategic planning, that you can use to advocate and lobby your legislative, committees, or folks that are making policy decisions or funding decisions. It can also help you in terms of your sustainability planning, whether you have a grant or not, because it can help you focus your resources to know where, what are those items and indicators where you need to put more time and energy. And so really encourage you all to continue to investigate. If you can flip to the next slide, please. And one last note here before you fill out the evaluation is we have our 2nd annual System of Care Summit coming up. This is open to everyone. It's going to be a really exciting couple of days. It is virtual. Please register, or we have registration information coming soon. We have a proposal submission process. So if you want to share the great work that you all are doing, the deadline for that is coming up next week. Please do that. Karina's posting some links in the chat so you can grab them. We're really excited about this. It's going to be great, and it's going to be all about SOC all day long. And we're going to have a focus on equity, family partnership, youth partnership, and workforce development. So really appreciate you all joining, and thank you so much for attending today's session. And I do believe that by some miracle, we finished right on time. So we did it. So thank you, everyone. And thank you in advance for completing the evaluation. And we look forward to reviewing your feedback and seeing you all at our next INTAC event.